Welcome back. Today I'm talking about, is my knee pain caused by my meniscus? So I'm going to talk a little bit about anatomy of the meniscus, but what signs and symptoms you could have and how you could have injured it if you have a meniscus problem. So how do I know if my knee problem is my meniscus? One of the indicators that your meniscus is the problem relates to the injury. Meniscus tears happen typically with a non-contact injury where there's pressure and a twist. So think about planting your foot and then having a twist at your knee. Another way the meniscus can get injured is repetitive motion when you squat deep over and over again and over time. Like if you've been working in a type of job that requires you to stay in a deep squat for a prolonged amount of time. So what are the symptoms of meniscus tear? Most people who have a meniscus injury have a feeling like their knee is going to give way on them. And if they have a particular kind of tear, their knee can get locked in place where they can't straighten it out all the way without somebody else's help. Okay, so what exactly is a meniscus? So meniscus is a cartilage substance in your knee joint. You actually have two menisci, plural, in each knee, a medial on the inner side of your knee and a lateral on the outer side of your knee. I'm not going to go too much into the anatomy here, but different parts of the meniscus have different amounts of blood supply, which is why sometimes they can do surgery and sometimes they can't do surgery to fix a meniscus tear. Okay, so what is a meniscus tear? It can be a slit, it can be a handle-looking flap, or it can be a rip. These tears typically happen when you put weight through the joint and twist, just like I mentioned above. This causes a compression on the cushion and then a shearing force, which makes it tear. So who gets this? The tears can occur in the athletic and the non-athletic population. Someone who's playing in a sport or activity and plants their foot and then twists creates a tear. It can also happen just from normal joint activity where the meniscus has just worn away in some spots. Over time, this worn out spot can get irritated and inflamed, causing pain and swelling. Meniscus tears are more likely to happen to someone who has a job that involves a lot of squatting, ladder or stair climbing, or crawling on your hands and knees. So what's the prognosis? What's the outcome? What's life going to be like with a meniscus tear? Most people can live with a torn meniscus. It usually just depends on how inflamed and irritated it is. Sometimes, and especially if it's a bucket handle tear, the tear keeps flipping back and forth, and so it keeps getting inflamed. Other times, the tear just sits there, and if the irritation can be calmed down, then the person can live a normal life with the tear and just manage the symptoms. So do you need surgery? Maybe. Maybe not. In some studies, it's suggested that arthroscopic meniscal debridement, where they just clean up the meniscus, occurs up to 700,000 times a year in the US. And not everyone needs or gets the surgery. See, there are two types of surgery, a meniscectomy, where they just clean out and chomp out the tear, or a meniscus repair where they actually sew it up together. Now, depending on what type of tear and where the tear is going to help determine what kind of surgery you had. Remember, I said that not all parts of the meniscus have good blood supply, so they're not going to repair an area that doesn't have good blood supply because it's never going to heal properly. So they would end up cutting out that torn meniscus. So what are some things that you can do to prevent a tear? Strengthen the muscles in your leg, your hips, knees, ankles, core exercises so that your body has a better amount of control over the motion your body goes through during daily activities and sports. By keeping your legs strong, you have an improved chance of your muscle memory kicking in when you do these activities to keep your knee joint from getting into unwanted positions. Doing regular exercise also keeps your joints healthy, so there's plenty of lubricant in the joint to keep things moving smoothly. Okay, so to recap, someone with a meniscus injury may feel pain and may feel like their knee is going to give out on them, or it may lock in place. The initial injury was from a non-contact compression with a twist, or you worked in a job where you had to do a lot of deep squatting, ladder climbing, or stair climbing. Building up good strength and flexibility can decrease the risk of injuring your meniscus or your knee in general. For more tips and tricks, follow along.